In this SD Solution Spotlight, we're going to be talking about food insecurity. It's well established that food insecurity directly impacts healthcare utilization, cost, outcomes, and equity. Food insecure adults have average annual healthcare expenditures that are $1,834 higher than otherwise similar populations. So if you're a health plan or a health system engaged in risk-based contracts, or even a self-funded employer, the question really becomes, what do you do about this? For us here at Socially Determined, it starts with identifying risk. To that end, we've built models that quantify the food landscape at the community level and food insecurity at the individual level. We use these models to help proactively identify specific neighborhoods and subpopulations within our clients' full markets and memberships for which we see food insecurity having the greatest impact. Once we understand those contours and concentrations of risk, the question then becomes how best to mitigate it. To that end, we drill deeper, looking at specific influencers and drivers of risk, such as the accessibility or affordability of food, that tell us how best to support that need through tailored evidence-based interventions. And the good news is we've seen over and over again that this type of proactive identification and tailored support translates to real ROI. For example, one of our clients applied our social risk intelligence to identify members at risk of food insecurity with diet-related chronic conditions like diabetes or hypertension. They then partnered with a local community-based organization to deliver medically tailored meals to those members. And they saw that that resulted in real improvement in a number of metrics that matter to them. So for example, there was a 33% reduction in low acuity ED utilization among that member population, a 23% reduction in potentially preventable admissions, and a 59% reduction in 30-day all-cause readmissions. That translated to real savings for the plan, but also importantly, to better outcomes and experiences for their members.